This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
Colorectal cancer, also called colon cancer, is the third leading cause of cancer deaths among men and women. Yet with proper screening, it can be caught early and cured. March is Colorectal Cancer Awareness Month, and joining us to separate fact from fiction when it comes to the disease is Dr. Halim Sharbel of Peninsula Regional Gastroenterology Medicine. Thanks for joining us this afternoon. Well, let's just start off by asking, what is colon cancer?
Colon cancer is a malignancy that occurs in the colon, the large bowel, and it usually forms as a small polyp, and it grows into a mass that can obstruct the colon, or it can spread to other organs, and it can kill you, obviously. And it happens very often, and everybody is at risk for colon cancer.
Right. I thought it was more for men. I mean, only men got it, but men and women can get colon cancer?
Absolutely. There are some misconceptions about colon cancer, and that really is impediment to the screening. One of them is that only men are at risk. Actually, both men and women are at risk for colon cancer.
And are there other risk factors for colon cancer?
Yes, the risk of colon cancer increases with age. So everybody is at risk, and the risk goes up. If you have a family history of colon cancer, the risk increases significantly. If you had colon polyps before, that increases your risk for colon cancer. And if you have certain diseases such as inflammatory bowel disease, Crohn's disease, or ulcerative colitis, this also increases your risk of colon cancer. Some people have genetic syndromes that run in the family, and that put them at significantly higher risk of colon cancer also.
Well, the one thing about colon cancer, it's quite easy to screen for it. How do you screen for colon cancer? There
are multiple methods for screening. One of the best known methods, and probably the best method for screening, is colonoscopy. Basically, you put the patient to sleep after giving them a bowel prep, and you go in with a flexible tube with a camera and a light inside the colon to look for cancer, to catch it early, but most importantly, look for polyp. So you look for the lesion before it becomes cancer, and you can remove it and prevent it from becoming cancer altogether. Now, there are other possibilities that you can use. There are virtual colonoscopies, which is basically a CT scan that can detect larger polyps. We use it mostly for people who cannot tolerate colonoscopy. There are barium enemas, flexible sigmoidoscopies, which are other tests that are also used in practice. More importantly, there are tests that can be done in the office or at home, tests to check the stools for microscopic blood, and that basically helps us find the cancer early, so we can treat it. So there are multiple options. Not every test is good for everybody, so you probably need to discuss it with your doctor to decide what's the best.
Right, but the colonoscopy is the best one. How often should we have these screenings?
In general, you start screening at age 50. And then we do it every 10 years if you don't have polyps. However, if you have a family history of colon cancer, we need to start earlier, so we start at age 40, and we do it every 5 years. If you have a colonoscopy and you're found to have polyps, then you need a colonoscopy every 5 years also.
Now, when you do get colon cancer or you have the polyps, are there symptoms that you need to be looking out for, something that may indicate you need to be screened?
Polyps do not cause any symptoms. That's why we recommend screening for everybody, even if you're not having any symptoms. However, colon cancer can give you certain symptoms, most importantly, blood in the stool. So if someone notices blood in the stool, it can be a symptom of colon cancer. Having said that, it can be something benign from something else, such as hemorrhoids, but it definitely needs to be worked up. There are other symptoms such as unexplained abdominal pain, change in bowel habits, which is new onset constipation or worsening constipation, or thinner than normal stools. And one of the things that prompt us to screen for colon cancer is if you have anemia that is not explained by anything else.
Right, right. And what about treatment if you do find out that you do have colon cancer?
It is very important to try to detect colon cancer early, because if it is detected early, 90% of the patients are alive after 5 years. However, most colon cancer is detected late. And if it's detected late at an advanced stage, if it's spread to other organs, then you cannot do surgery, so you have to treat with chemotherapy or other options. And if it's detected early, depends on the stage. Many people can just get surgery and get completely cured, or surgery followed by chemotherapy.
All right. Very important information. Bottom line, get yourself screened, right?
Absolutely. Any kind of screening is better than no screening. So only 50% of the people in the US who are eligible for screening are actually getting screened. So we need to work hard on getting more people screened.
We need to bring that number up. Thank you so much, Dr. Sharbel. And to learn more from Peninsula Regional Medical Center about colorectal cancer, including screening, symptoms, and treatment, go to our website, delmarvalife.com. And if you are diagnosed with colorectal cancer, perhaps you can ease some discomfort by electing to have chemotherapy in your home. You may be surprised to find out that is an option. We'll find out how it works next, plus learn if any other cancers can be treated at home. We'll be right back.